Hello and welcome to NewsClick. Today we are joined by Prabir Purkayastha to discuss the recent outbreak of the new strain of the coronavirus. This outbreak began in the Wuhan city in China, and nearly 2,800 people have been affected in the country so far, and 80 deaths have also been reported. The virus has also spread to other countries like US, Canada, Japan, Taiwan, etc. And a handful of cases have been reported there as well. So, Prabir, can you first tell us what do we know about the virus so far? How does it spread, and what kind of impact does it have on the body?
Well, there's three questions. But coming to that, what is it? This is a class of viruses which travel basically airborne and affect the respiratory tract. By the word coronavirus doesn't mean that it's very dangerous. Even the common cold is a coronavirus. The flu is a common coronavirus. Of course, flus can also have different variants of how deadly it can be. We had the pandemic in 1918, which killed a huge number of people. Coming to this particular one, this seems to have been possibly from a bat reservoir which came into the human population. This animal to human transmission sometimes happens that it is restricted to only that population and the human getting infected. There is no human to human transmission. When it also has a human to human transmission, that it jumps the species, but also has a human to human transmission, obviously it spreads much more. So, for instance, we have the Middle East Respiratory Syndrome, the MERS syndrome, which has also been there, which happened in 2012. Now, that did not have this kind of spread, mainly because it was an animal to human transmission. In this case, it has jumped the species, and it's also been able to be transmissible across humans. That means human to human contact has led to its spread. Now, this is one part of it. This is what we seem to know. It appears it has been identified, the virus has been identified genetically, and we may be in a position now to look at both finding out how to identify the infection more faster, more clearly. That is one. And secondly, possible vaccinations, etc., that can follow. But effectively, the response medically to is, the first line of response is isolation, quarantine the patients, isolate the suspected population who are in contact with the patient. So this is the first step. And the second step is keep them under conditions by which you can fight the consequence of the virus. And the third, possibly later, is what is the medicine we can give them to really combat the infection. So these are the three steps that we have to take. We are really in step one and step two. The Chinese have acted very swiftly this time, unlike the earlier case where the SARS, again a respiratory tract infection, which had spread quite far in China. The Chinese authorities were that time criticized for not taking it seriously early enough. This time, one of the doctors who had led that criticism has been put in charge of the response. They have also really locked down a town of 11 million citizens. Now, that's a huge, huge step. So, locking it down, and they've also stopped any people going in or out of Wuhan. Essentially, you can still go in, but you can't come out of it. So they have quarantined the whole town in that way. They've also built temporary hospitals where they are putting in suspected patients. You see, though about 2,800 have been identified to have had the infection, there is still about 5,000 people who are suspected. We don't know whether they have the infection or not, so they'll be tested. And there is another 30,000 who have come in contact with this population, who are also being kept under watch to see whether they develop symptoms or there are antibody reactions we can see later. So I would say the Chinese have acted very, very swiftly this time. What they have done is unthinkable for a lot of countries. I cannot think of quarantining a town, the city of 11 million population. I can't think also of the kind of lockdown they have in Wuhan itself. And also in a lot of other cities, mass transport has been stopped. So people are only going when emergency requirements are there. They've also extended the holidays by 3 more days. This is a big holiday period in China. They have extended by 3 more days. So to reduce the chances of students coming in with possible infection. So all these steps they have taken. I'm hoping the speed at which this transmission is taking place will slow down. At the moment, we still see a large number of cases. 24 hours, about 800 odd cases have appeared. I'm hoping these numbers, though still large, the rate of acceleration of these numbers will slow down, and slowly it will actually drop. So this is the current situation. Yes, it's a grave situation, it's a health emergency, but this kind of virus outbreaks are likely to happen. And let's not forget, China and India put together is about 40% of the human population. So it's not surprising that if infections do start, they're likely to start from where the population is large. And India and China, in this case China, will figure prominently in such a list of centers from which such infections takes place.
And there are reports that the virus itself originated from this animal market in Wuhan. So what do we know about this so far? How confirmed is it? And how important is it to identify the source of the virus to stop the spread?
You see, the earlier virus, the SARS virus, also came from a bat population. The argument was the bat to human population is not how it transmits itself. From bats, it goes to an intermediate animal host from which it jumps to the human population. Now, in this particular case, initially the argument was it was transmitted by snakes, that snakes would have had the virus infection in a native form, and then it jumped the species from a snake market, where in this particular season Wuhan has a market where such animals, wild animals, are traded and eaten. Okay, as you know, snakes are also eaten in China. But it seems that this also has been debunked right now. So the argument is still the likely candidate is the bat population, like the SARS virus, and it's possible there is an intermediary host which shared the virus and then it jumped from that, or it jumped directly. At the moment, it's not clear where it originated from. The two other things I'd like to share with you. One is that when you talk about infection of this kind, and this is obviously a dangerous infection, if you look at the two statistics we should really look at. One is how many people are getting infected by one infected person, because that shows the rate at which the disease would spread. And here again there are conflicting figures because it's early days yet. So the figures are 1.4 to something like 3.8. Now, this is by itself not so important. You have to see it in conjunction with how many fatalities occur. Now, again, this is early days, so we don't know what the actual fatalities are likely to be. But at the moment, the fatalities seem to be about 4% or so. But let's not forget that those who have been infected, still we do not know whether they all will be well, and with the 4% would continue, or a larger number of people die in the coming days. So this is an uncertain area, but nevertheless, once they reach a hospital which is equipped to handle them, I do believe that the fatalities could stabilize. This should be compared to, for instance, you take Ebola. The figures are anything between 30% to 90% fatalities, though Ebola infection rate is 1.5 to 2.5. So this is, the infection rate is not that high. For instance, if you see like something like measles or mumps, those have higher transmission rates, or whooping cough, which has 12 to 17% transmission rate. But the number of fatalities have to therefore be taken also into consideration. Ebola is such a fearsome disease because the fatalities are very high. So here we have much lower fatalities. In fact, the SARS virus had 9 to 16% fatalities. MERS, the Middle East Respiratory Syndrome virus, which was the one which affected the world in 2012, has about 30 to 40%. So I think this is showing more than around 4% fatalities. If these figures hold true, this will wear out pretty quickly. But nevertheless, the fact that the transmissibility today is still 1 is to 1.4 to 4, we don't know what the actual figure is, would seem to indicate that it has to drop below 1 for the epidemic to peter off. And that's what we should be watching, that all the measures which have been put in place, quarantine, looking at the suspected people, isolating them from the population, all of these, if they work, that this figure should drop and then the pandemic should really peter off.
And if you talk about the vaccination, so this particular strain is being called the novel coronavirus. It's from a known family of viruses. So does that mean that the process of developing a vaccination would be easier in this case, or we don't know so far?
At the moment, I would still call it an unknown coronavirus. Okay. So you know the family, but you don't know the member. And each virus member signature would decide whether you can really have the virus, an antibody against it, or you have a vaccine against it. So I think we are again in the unknown territory yet. But if we have identified the virus, then vaccine is probably not that difficult to develop after that. The question is to develop the vaccine and put it in the population quickly. That also such a large population. Wuhan itself has 11 million population, and then already it has spread to almost every major province of China, though it has spread only to selected places within those provinces. So I think vaccinating, again, 1.5 billion people, that's a tough ask. So we'll have to see. First is vaccinate those who are likely to come into contact, vaccinate the hospital workers, all of these, the healthcare personnel. If you can do that, that itself will slow the disease down. But yes, vaccination is not the first line of defense as of now. As of now, treating these patients, isolating them, quarantining them, and then possibly using some medicine we can develop quickly and which will help the antibodies to fight the vaccine, fight the disease, I think is at the moment the way to go. So yes, good that we have isolated the virus so quickly, but will it lead to a quick development of the vaccine and its mass ability to vaccinate across a very large section of the population? That we have to see.
Thank you, Prabir, for joining us today. And that's all the time we have. Keep watching NewsClick.